So with all this talk about diffusion and gases, one thing that we have left out in this equation is blood flow, right? If we're not providing blood flow to the lungs, then there is not any diffusion or transport of gases that takes place. So what we're going to do in this section is very briefly just talk about the pulmonary circulation, right? Delivery of blood flow to the lungs so that gas exchange can occur. So first, the rate of blood flow throughout the pulmonary circulation is actually equal to that of the systemic circulation. However, the pressure is much, much lower in pulmonary versus systemic circulation. As a brief aside, of course, if you have something like COPD, you can actually see that this pressure goes up higher, which causes extra work on the right side of the heart pumping to that, which can ultimately lead to some type of heart disease or cardiomyopathy. But back on topic. So again, much, much lower pressure in the lungs than generated in the circulation. During exercise, we can get a slight increase in pulmonary blood flow, which is ultimately will then increase pulmonary arterial pressure. But because the resistance in the pulmonary vascular resistance seems to fall, we can say that that is because of, again, two of our main reasons for systemic vascular resistance that we talked about in the systemic circulation. We get a dilation of vessels and a recruitment of previously unused capillaries. However, all this blood flow going to the lungs is not equal. And indeed, gravity has a really important impact on blood flow to the lung. So as you can see, in the supine position, we have uniform blood flow to the lung. However, when standing, most of the blood flow actually goes to the base of the lung due to this, again, as the effect of gravity. At upright, so again, if we're looking, so here's bottom of the lung, here's top of the lung. As you can see, the top of the lung gets much less blood flow than the bottom of the lung. Exercise, again, due to an increase in blood pressure, will actually be able to perfuse more of the lung, but we still see that the bottom of the lung doesn't get equal pressures. Right? So how does this actually relate to gas exchange and breathing and providing oxygen and CO2? What it does is that normal gas exchange, of course, requires a matching of both ventilation, so oxygen and CO2, to blood flow. Right? What we do is we call this VQ, or the ventilation divided by Q, which again comes from our definition of cardiac output for blood flow. In other words, the alveoli can be well ventilated, but if blood flow is not adequate, gas exchange is not going to occur or is going to be inadequate. Right? Our ideal matching is about a VQ of 1. So what does that mean? When we look at a VQ of 1, then we would say the liters of air that we're breathing through ventilation is equal to the liters of blood flow per minute. Again, so we can see here our ventilation and our blood flow. Again, as we talked about, there are differences in blood flow, right? The base of the lung gets a lot more blood flow than the apex. So here's a great example, 1.9 liters per minute to the very top of the lung, which is 0.07. So this would again be a good example of a standing. Right? If we look at the perfusion, ventilation is 2.24 liters. So if we divide that, we get a VQ of 3.4. A very large VQ ultimately represents a disproportionately high ventilation relative blood flow. Ultimately, this results in poor gas exchange. Okay? In the apex of the lung, we actually have a slightly different value. In this case, we have a VQ where our blood flow is higher than our ventilation. Therefore, our VQ, we have another what's called a VQ mismatch, which means that we are over-perfusing the lung, right? We're getting more blood flow than oxygen, and so all of that blood flow isn't able to pick up enough air through there, and therefore we get, again, poor gas exchange. So in general, we would love to have an ideal value of 1, but we can most for most things, we can say that a VQ of greater than 5 is adequate for gas exchange and won't really cause any deficits. Right? Light exercise, because of our increase in cardiac output and increase in blood flow to these areas and increased rates of ventilation, we will actually improve our VQ and get our VQ matching much closer. At heavy exercises, this will be a topic we'll touch on later, can result in small VQ inequalities and in some cases can impair gas exchange, which may have an effect on performance. We'll talk about that later on in this chapter. So in summary, efficient gas exchange between blood and the lung requires adequate matching of blood flow to ventilation. Blood flow, again, Q, and ventilation that we normally abbreviate as V. So we call it VQ match, or most commonly VQ mismatch. The ideal ratio of ventilation to perfusion is 1 or slightly greater, since this implies a perfect matching of blood flow to the rate of ventilation. Right? And since this pulmonary system is a low-pressure system, the rate of blood flow is equal to that in the systemic circuit. However, unfortunately, in the standing, most of our blood goes to the bottom, not the top, and that is improved slightly with exercise.